Just as a reminder, DESTINY-Gastric02 is a single-arm Phase II study that was conducted in North America and Western Europe, and it's evaluating the activity of trastuzumab deruxtecan, or T-DXd, for patients with HER2-positive esophageal gastric cancers who previously experienced progression on a trastuzumab-containing regimen. So a very important feature of the study is that the eligibility required central confirmation of HER2, but also based on a biopsy that was obtained post-trastuzumab progression, as we now know from multiple data sets that up to 30% of tumors that are previously HER2 positive can become HER2 negative. So these results actually were presented 1 year ago at ESMO, and the update was based on a more recent data cutoff from November of 2021. So with the recent update, the objective response rate is 41.8%, which is actually a little bit increased from last year because there were several patients at the time who were awaiting the confirmatory scans. For the first time, we were also able to estimate survival data. The median overall survival is 12.1 months. Median progression-free survival is 5.6 months. The toxicities really largely remain the same. The drug is reasonably well tolerated, although a significant proportion of patients do require dose reduction and some even discontinue treatment because of the drug. And certainly I think one toxicity that all practicing physicians have to be aware of is interstitial lung disease or pneumonitis. And this occurred in about 10% of patients on the study, which again is very consistent with other studies of T-DXd in other tumor types, but also in gastric cancer. Unfortunately, 2 of the interstitial lung disease events were actually fatal, so which really reinforces the fact that I think physicians have to be very familiar with identifying and treating these events when they occur. The last new piece of information that I presented was quality of life data from patient-reported outcomes, and it was reassuring to see that through cycle 7, which is about month 5 of treatment, there was preservation of quality of life. Patients' quality of life didn't suffer because of progression of the cancer, but because of toxicities from the drug. So all in all, the data reinforced the fact that in the US, T-DXd is approved as post-trastuzumab therapy, meaning that it can be offered in the second line and beyond. Now, outside of the US, the only other regulatory approval is in East Asia, where it's actually approved as third-line therapy. But there is currently an ongoing Phase III study called DESTINY-Gastric04, which is looking at the combination of T-DXd versus ramucirumab paclitaxel as second-line therapy for HER2-positive disease that has also previously progressed on a trastuzumab-containing regimen. And if positive, that Phase III study hopefully would then lead to regulatory approval of T-DXd around the world.